Good morning, students. Here we come up with the gross anatomy lecture of hip joint. Now in the hip joint, we are going to discuss in different segments. Very important and very interesting lecture. Our first segment is our today's topic, which is known as articulating bones in the hip joint, formation of hip joint. So articulating bones. This is our topic, articulating bones in the formation of hip joint. Whenever we describe any joint in the gross anatomy, whenever we write down, always remember that the first point to be discussed will be definition. In the definition, it involves the type of the joint. So the definition of this will be, it is a multi-axial ball and socket variety of synovial joint. Please note down, hip joint is a multi-axial ball and socket variety of synovial joint. This completes the definition of hip joint. Second point will be always. Second point, in any joint in the human anatomy, second point will always be, after the definition, articulating surfaces or articulating bones which form the respective joint. Here, in this case, hip joint. So, which are the articulating bones that will form to the formation of this hip joint? These articulating bones are joined by articulating surfaces. That should be the second point. And third point, in any description of the joints of the human anatomy will be ligaments. So third point, if you consider the third point, it is always the ligaments of any particular joint. Here, ligaments of hip joint. Fourth point will always be related to blood vessels and nerve supply of the respective joint. And here in this scenario, blood vessels and nerve supply of hip joint. And the last point should always be, point number 5, it should always be applied anatomy of that particular joint. As usual here, applied anatomy of the hip joint. So these are the points which we have to follow. Now our today's topic, definition we have completed. We are going to discuss the articulating bones. Now in the articulating bones, here on this side, please draw alongside with me, this will be the femur. Now here, this femur, please draw the neck of the femur and then the head of the femur. So this bone over here, femur, greater trochanter, lesser trochanter, neck and the head of the femur. So here I am going to write down the head, this will be the neck. Now after drawing this much, we are going to draw, now remember this is a cross section, so we are going to draw the hip bone, and that hip bone will be the acetabular margin, the acetabular margin of the hip bone. So this, once again, this is the acetabular cavity of the hip bone which we have drawn, and therefore here we are going to mark down, this will be the acetabular cavity of hip bone, and of course this is in cross section, so therefore here we are going to put some color inside. So this is pure bone, it should be demarcated as, this will be our cross section of the acetabular cavity of the hip bone. So here this much is acetabular margin. Now the articulating bones which will take part in formation of the hip joint will be two. Number 1, this is number 1. The first part will be the head of the femur. It is the head of the femur. Second part which will take part in articulating portion will be acetabular cavity which will form socket-like structure. Head will form ball-like structure and acetabular cavity will form socket-like structure. So the second bone which will participate, the second articulating bone which will participate in the formation of the hip bone will be the acetabular cavity. So therefore it is ball and socket variety of synovial joint. Ball which is formed by the head of femur and socket which is formed by the acetabular cavity. This much you have to note down, 2 points. Now further, both the articulating surfaces you have to describe. So how do you describe? You go in a simple diagrammatic way. Since we have drawn this diagram, now first you describe this point number 1, head of the femur. Now head of the femur will form, here I am going to draw the cartilage. Head of the femur will form 2/3 of the sphere. This is 1 mark MCQ which is generally asked. So here we are going to write down it will form more than 2/3 of the sphere. Please note down this important point. Head of the femur will form 2/3 or more than 2/3 of the sphere. Point number 1. Point number 2 will be the entire head of the femur will be articular, except in the center where there will be a small depression which is called fovea. That small depression will be known as fovea or the pit, and that depression will be present here. So here you will have a small depression in the middle of the sphere of the head of the femur. This is called fovea. And in the fovea there is attachment of the ligament of the head of the femur. So there will be attachment of the ligamentum teres, or it is called ligament of head of the femur. So this is how the ligament of the head of the femur is attached. To this fovea there is attachment of the ligament of the head of the femur. So therefore in this fovea, the next point you can mark down, to this fovea there will be attachment of ligament of the head of the femur, or it is called ligamentum teres. Either it is called ligamentum teres or ligament of head of femur, which is attached to the fovea. Fovea is a small depression in the middle of the head of the femur. These are the points which you need to mention. Then the very important point, cartilage. The head of the femur is covered with articular cartilage, which is hyaline in nature. So it is covered by hyaline cartilage. Draw this cartilage in this way. It is covered with hyaline cartilage in such a way that, now it is covered with hyaline cartilage in such a way that the central portion, which I am coloring, the central portion will be thicker and its peripheral margin will be thinner. So here, make sure that the central portion is thicker, this is thicker, and its peripheral margin will be thinner. So you can see that here, this is thicker, and peripheral margin where it is tapering, this will be thinner. This is the shape of the hyaline cartilage, articular cartilage. So here, you mention here, hyaline cartilage, which will be known as articular cartilage, which is thicker in the center, thinner at the periphery. It will cover the entire convexity, the entire sphere of the head of the femur, except fovea. Except fovea, it will cover the entire head of the femur. That is articular cartilage of the femur. And here we are going to mark this as hyaline cartilage. Then, next point. Now, since we have discussed all the points about the head of the femur, now it is mandatory to mention the neck. The neck shaft angle. Remember, the head and neck of the femur is directed upwards, forwards and medially. There will be the angle which is produced between the neck and the shaft of the femur. So therefore, the neck shaft angle will be around 125 degrees in adults. Please mention this angle, 125 degrees in adults. And it will be around 160 degrees in children. This is also asked in MCQ, 1 mark question answer. The neck shaft angle of the femur in adults will be 125 degrees, and in case of the children it will be around 160 degrees. So therefore, here you mention about the neck shaft angle also. These are the points which have to be mentioned in the head of the femur. Now, after discussing the first segment of the articulating bones, we move on to the second segment. if we come on this side. Now here the second segment, here we will consider this diagram and we are going to write down the points. Second segment. Second articulating bone is by the cup shaped. What is the shape? It is cup shaped. Cup shaped acetabular cavity of the hip bone. So the cup shaped acetabulum of the hip bone will form socket like structure. That is the word which we have used. Ball and socket variety of synovial joint. This is the category of synovial joint, ball and socket variety. Ball is formed by the head of the femur and socket is formed by the acetabular cavity. So therefore, now please come on this side. If I draw here, now here I would like to draw, if I draw here, this is the acetabular cavity. Now this is the acetabular cavity, please draw, and this acetabular cavity we are going to show like this entire cup-shaped acetabular cavity. Now here, this cup-shaped acetabular cavity will form the socket. So therefore, point number 1, I am going to write down here, point number 1 will be acetabular cavity. Point number 2 will be, this entire acetabular cavity is composed of 3 bones, ilium, ischium, pubis, which are joined by triradiate cartilage. Triradiate cartilage which is Y-shaped. So therefore, if I show this cartilage here, this cartilage, Y-shaped cartilage will be here. This will be the triradiate cartilage. And remember, this triradiate cartilage which is Y-shaped will join 3 bones and they form the acetabular cavity. What are those 3 bones? Ilium, ischium and pubis. Ilium, ischium and pubis. By Y-shaped triradiate cartilage. So the name of this cartilage, we are going to mention this as triradiate cartilage. This is the second point which you have to mention here. Now this cartilage, when does it ossify? It will ossify by around 12 years. So by 12 years it will ossify. It will start its ossification by 12 years, and by 20 years the ossification will be complete. That also you have to mention. This cartilage will start its ossification by 12 years, and by 20 years of life the ossification will be complete. So therefore, after 20 years this cartilage will disappear, because by this time the entire acetabular cavity is formed by all the 3 bones that have fused, ilium, ischium and pubis. Next point. Next point, what you need to show will be, after this cartilage, if I rub this cartilage, I will just rub this cartilage, and now we are going to mention the lunate surface. But before lunate surface, we are going to mention the margin. The entire acetabular cavity will have the outer acetabular margin. So this is the outer acetabular margin. This is the outer acetabular margin which is deficient below. And this deficient part inferiorly is known as acetabular notch. So you will feel with your fingers on the hip bone, there will be acetabular notch in the inferior margin of the acetabulum when you see the hip bone, when you feel the hip bone at that time. So therefore, this portion over here, we are going to mention this as acetabular notch. This is another point. What is acetabular notch? It is a gap which is there present on the inferior margin of the entire acetabular cavity. So outer peripheral margin is formed by acetabular margin. The outer peripheral margin, this is formed by acetabular margin which is deficient below, and that deficient part is called acetabular notch. Now the outer acetabular margin will have attachment of acetabular labrum. That is a acetabular labrum, that is a fibrocartilage, and here if I show this, this is acetabular labrum. Now this acetabular labrum will be attached on the outer acetabular margin, and this acetabular labrum will provide the socket in such a way that it will give the greater depth to the ball and socket variety of the synovial joint. So it will increase the depth. That is why this fibrocartilage will be attached on the outer margin of acetabulum, or on the acetabular margin it is attached. And this fibrocartilage is called acetabular labrum. So please mention this as next point. This will be the acetabular labrum. What is labrum or what is acetabular labrum? Both are one and the same. Either you term it as labrum or acetabular labrum. It is a fibrocartilage which is attached to the outer margin of acetabulum, which is called acetabular margin. After this labrum, now next point, we come back to notch. Now this notch here is, there is deficiency of the acetabular margin, so it is called acetabular notch, and this notch is bridged by, there will be attachment of two structures on this notch. The two structures will be, the first structure, I am going to have a different color, so I am going to draw here with blue color. I am going to show the two structures will be, this is the first structure. Now this structure is transverse acetabular ligament. This transverse acetabular ligament will bridge the acetabular notch. So therefore you have to mention here, next point will be the transverse acetabular ligament, which will bridge the acetabular notch. And the second structure which will be attached will be, the second structure which will be attached to this acetabular notch will be the base of ligamentum teres, or the base of ligament of head of femur. So here I am going to show this as the ligament of the head of the femur. So this is how it is attached. The ligament of the head of the femur. Of course this is the cross section. So I am just showing this. The base of this ligamentum teres or ligament of head of femur is attached to the acetabular notch, and therefore, or it is attached to the transverse acetabular ligament. So therefore here we need to mention the ligament of head of femur or ligamentum teres, or it is called ligamentum teres. The base of this ligament is attached also to acetabular notch. Two structures are attached, transverse acetabular ligament and the base of the ligament of the head of the femur or ligamentum teres. Now, the gap which is present below the transverse acetabular ligament, that is the gap which is present between transverse acetabular ligament and acetabular notch. Through this base there will be passing of two important structures, and those two important structures will be these structures which are passing, they are known as acetabular branches of the obturator and medial circumflex femoral vessels. So here these are the acetabular branches of the obturator and medial circumflex femoral vessels, and these vessels will pass through the gap between transverse acetabular ligament and the acetabular notch. This is one mark question answer. So therefore here we are going to mark this as the acetabular branches of obturator and medial circumflex femoral vessels. Please note down. These are the acetabular branches of obturator and medial circumflex femoral vessels, which will pass between acetabular notch and transverse acetabular ligament. And also another MCQ is, what are the structures which are attached to acetabular notch? Two structures, transverse acetabular ligament and the base of ligamentum teres. So coming up. So therefore, these are the two MCQs. Please note down this here. After finishing this, we come to this horseshoe shaped surface which we have drawn. Now remember, this acetabular cavity, we have seen the formation of acetabular labrum, fibrocartilage, we have seen the formation of acetabular notch, we have seen that two structures are attached on acetabular notch, we have seen that two structures are passing in the gap between transverse acetabular ligament and acetabular notch. Those structures are the acetabular branches of obturator and medial circumflex femoral vessels. Now, lunate surface. There will be the articular surface of the acetabular cavity. This is the articular surface, and this articular surface is known as the lunate surface. So it is called lunate surface. and this entire lunate surface, horseshoe shaped lunate surface, which will be present from anterior, superior and posterior region of acetabular cavity. So the anterior, superior and posterior region of acetabular cavity, you will see that there will be a smooth horseshoe shaped lunate articular surface. So it is called the lunate surface, which is articular with the head of the femur. So therefore this lunate surface will be present in which parts? 1 mark question answer. In which parts of the acetabular cavity? Anterior part, posterior part and superior part of acetabular cavity. It is an articular surface where it will provide articulation with the head of the femur. So it is lunate articular surface. It is covered by hyaline cartilage. So this articular lunate surface will be covered by hyaline cartilage. Please note down. And it will be present in anterior, posterior and superior part of the acetabular cavity. Now the thickest part will be present in the posterior superior part. Thickest part of this will be present as a buttress in posterior superior part of acetabular margin, where it will be present in the form of a buttress. Then we come to the next point. So here we mention here the lunate surface, which is articular. This is the next point which we have to mention. And here we mention the last point. Now this, where my hand is there, the central portion, this is called acetabular fossa. What is it called? So I am going to write down acetabular fossa. This acetabular fossa is covered with semi-fluid or semi-liquid fat. It will be loose areolar tissue like proportion. So it is covered with loose areolar tissue which is present in the form of fat. This fat will be acetabular fat. So please mention here I am going to mark down, this is acetabular fossa. Acetabular fossa is the central portion which is non-articular, and in this acetabular fossa, inside, deep, just below the lunate articular surface, there will be presence of loose areolar tissue which will function as semi-liquid fat and which will be covered with acetabular fat. So therefore, here this portion, it will be covered with acetabular fat, and this acetabular fat in the central portion, acetabular fossa, where acetabular fat is present, it is also known as Haversian gland. It is also called Haversian glands. And the portion here where acetabular fat is present, which is also called Haversian gland, will be present in liquid condition at normal body temperature. This is an important point. So it will be present in the liquid condition at normal body temperature, except in certain movements of hip joint. When the joint space is increased, this acetabular fat will help in filling up those joint spaces. So what is the function of this acetabular fat? During any movement of the hip joint, when the space is increased, that space will be filled up by this acetabular fat. But in normal body temperature, under those conditions, normal body temperature, this acetabular fat will be in liquid condition. And the most important point of this acetabular fat, please note down, it is lined by synovial membrane. So therefore it is intracapsular but extrasynovial. So here you have to mention, it will be, I am going to write down intracapsular, but at the same time it is extrasynovial. That is the condition of acetabular fat. It is intracapsular, but it will be present extrasynovial, external to the synovial fold. That is acetabular fat. So here we finish our entire discussion, all these points, entire discussion of the acetabular cavity. And here we have finished our entire segment of articulating surfaces of the hip bone or the hip joint, entire hip joint, which includes the head of the femur and the acetabular cavity of the hip bone. Thank you very much.